pain, and stiffness. These are some of the symptoms experienced by a person with arthritis. But as physical therapists, can we do something about it? Hello everyone, my name is Louise, and for today's episode, we're going to talk about arthritis. So, let's get started. Okay, so what is arthritis? Okay, let's start from the name itself, arthritis. So, arthro means joint and itis means inflammation. So, therefore, arthritis is a medical condition that is brought about by an acute or chronic joint inflammation. Okay, so it can affect people of different ages, but it is most commonly seen among the elderly. And sometimes, when people with arthritis go to the clinic, they would usually approach you, sasabihin pa nila, masakit yung kamay, masakit yung siko, yung tuhod, or yung paa, and they are pointing into the joint itself, no? And sometimes they would complain of those symptoms like pain and stiffness that last for a few days to week, no? Since arthritis is a form of inflammation, so we can see the 5 signs of inflammation when we see a person with arthritis. So number one, signs of inflammation is of course pain. They would complain of pain. Sasabihin talaga niyan, masakit, masakit itong kamay ko, masakit yung tuhod ko, masakit yung paa ko. Number two, when you observe the joint of these patients, makikita mo, especially when you compare, for example, the right and the left and one side is affected, that there is swelling or namamaga yung kanilang affected area. And then, when you try to look into it closely, medyo namumula-mula yung kanyang affected region. And when you touch it or when you palpate it lightly and compare it to the other parts of the body, there is actually an increased warmth on the area. And of course, dahil masakit at saka namamaga, so magkakaroon yan ng reduced function or sasabihin nila sa'yo ay mahirap igalaw. So, third, other symptoms that is presented as seen on different types of arthritis. Number one is called stiffness or yung paninigas. So, nahihirapan silang igalaw. So, essentially, naninigas yung kanilang mga joints. And then, tenderness is also known as your pain upon palpation. So, pag hinawakan, pag pinindot-pindot, masakit talaga. And then number three is joint crepitus or cracking. So, they would report feeling of cracking while moving, or upon moving, they would hear some cracks or sounds. So, it is called your crepitus. And then, of course, para siyang domino effect because the person is not moving, because of pain, because of inflammation or swelling, it could lead to muscle weakness because hindi na ginagalaw yung other parts of the body that is required to move that specific joint. Okay? Okay, so what is presented here are the common types of arthritis, no? So number one is osteoarthritis. So what happens for osteoarthritis? So let's imagine that these are the two bones, and essentially there is a covering on the ends of the bones called your articular cartilage. So what happens for arthritis is there's a thinning and destruction of those articular cartilage. Therefore, kapag nagkiskisan, no, if nag-move yung joint as nagkiskisan yung bones, it causes the pain and swelling and inflammation. Okay? Rheumatoid arthritis or yung rheuma or inflammatory type of arthritis. This type is more commonly affecting the hands. So if you have seen elderly people that have zigzag hands, so that is because of rheumatoid arthritis. The third one, spondyloarthritis. So there are more common types of spondyloarthritis called your ankylosing spondylitis, which is an arthritis that affects the spine. And then, another type of spondyloarthritis is what we call your psoriatic arthritis, which this type of arthritis affects the skin. So, the next one is what we call gout. Okay, gout is a crystal-induced type of arthritis, meaning there is a formation of crystals on the specific joints of the body that causes pain and swelling. So, usually, the number one joint that is affected for gout is the big toe. So, for people with gout, the number one risk factor is the high uric acid. And then lastly is your juvenile idiopathic arthritis. Essentially, it presents as same symptoms as adults, so may pain, may swelling, may inflammation. But what differs is it is also known as your childhood arthritis because it is more commonly seen on children age 16 and below. So, those are the different types of arthritis. Okay, so knowing all these types, what is now the challenge for the people with arthritis? So, number one, as we have seen or observed, they would have reduced mobility kasi they would have difficulty in moving their joints. Now, because of this, it will have a compounding effect or domino effect because reduced mobility could lead to difficulty in performing activities. So, what do we mean by activities? Activities of daily living such as walking, eating, bathing, or toileting, etc. So anything that requires movement of a specific joint that is affected na may reduced mobility can also lead to difficulty in performing those activities. And as a compounding factor, because you cannot perform your activities, it will also affect your social and leisure activities. So sometimes people who has those flares or attacks of arthritis won't be able to go to work or attend to their needs or attend to their activities. It's because they would have difficulty in moving their joints, no? So, what will be your goal for patients with arthritis? It is for them to remain physically active and healthy and to stay mobile and participate in meaningful activities. So, first question, why? Because avoiding movement can actually worsen the condition. So, even if there is pain and swelling and inflammation, we need to provide interventions that would decrease those symptoms and manage the pain so that the patient can still move and perform these activities. But how can physical therapy help patients with arthritis? Number one, we will assess the condition and their abilities. Same as all other cases, you need to identify the problems or the concerns of the patient so that you'll know how to, number two, create an exercise program for them. Of course, what we want is an individualized program that is fit for the needs of your patient. Okay? So, also, essentially for the exercise program, it has to be safe and effective for the patient so that they could build number one, strength for their body to move, stamina, kasi they have to last longer than the pain that they are feeling or the experiencing. And number three is, of course, what is the most important is mobility. So we teach them exercises to improve the mobility of the joint. Okay? Number three, what we mentioned earlier is about continuing physical activity. So how can they stay active? So we will teach the patient how to perform proper pacing of activity. So what do we mean when we say pacing? Essentially, we ask the patient to perform their activities and then incorporating ample amounts of rest so that they would not feel the flares of their condition. And of course, if the task is getting really difficult for them to work or perform their activities of daily living, we can teach the patient to modify, no? Modify or change a little for those activities that they're performing so that they could still do good and they can still perform well even if there are symptoms that they have experiencing. And of course, number four, help manage their symptoms. So what we want is independence from the patient because you want them to be self-efficient in managing their pain and symptoms. So of course, you teach your patient how to address those symptoms, no? So basically, that is the introduction of what is arthritis and what are the things that a physical therapist can do to address and manage their symptoms. No? So if you have specific questions or concerns, don't forget to leave them on the comment section, and I'll try to answer them the best way I can. And thank you for watching this video, and you can check out the next one. Bye!